And what's up mga champions? Magandang tanghali muli and week 6 na ng ating enhanced community quarantine sa Luzon at ibang bahagi ng ating bansa. Konting kapit pa at kakayanin natin to. Welcome to Mental Health Talks, Protecting Our Mental Health versus COVID-19. Episode 5 na. Ito ng series na ginagawa ng #MentalHealthPH in partnership with the Medical City Department of Psychiatry. Mapapanood ninyo ang ating mga previous episodes sa Facebook page at YouTube channel ng #MentalHealthPH. Last episode, pinag-usapan natin ang tungkol sa kung paano ba natin susuportahan ang ating mga frontline healthcare workers na humaharap mismo sa may mga sakit na COVID-19. Ngayon naman, pag-uusapan natin ang tungkol sa kung paano nga ba natin maiiwasan ang pakiramdam ng pagkabukod o isolation, depression, at mga bagay na nakakasakit sa ating sarili such as self-harm sa panahon ngayon ng COVID-19. Muli ako po si Nico Bautista ng Mental Health PH at ako ang inyong magiging host sa hapong ito. Susubukan nating sagutin ang inyong mga katanungan. Kaya naman, pakisulat ang inyong mga questions sa ating comment section na makikita sa ilalim ng inyong mga screens. Kung kayo naman po ay nasa Twitter, maaaring pakigamit na lamang po ng hashtag na #MHTalks. At may mga community moderators po tayo online na kumakalap sa inyong mga tanong at itatanong natin ito sa ating guest speaker mamaya. To start off this program, ipapakilala ko ng ating guest speaker. Siya ay nagtapos ng kanyang medisina sa University of the East Ramon Magsaysay Memorial Medical Center noong 2001. Naging psychiatry resident from 2010 to 2012 sa The Medical City. Then Department of Psychiatry at Consultation Liaison Psychiatry Fellow naman siya sa Tan Tock Seng Hospital. Then Department of Psychological Medicine sa Singapore from 2013 to 2014. Siya ay kasulukuyang naglilingkod ngayon sa Marikina Doctors Hospital and Medical Center, sa Rizal Medical Center at sa The Medical City. Mga champions, says all welcome, Dr. Danice Justin L. Santa Maria. Hi, Doc.
Hi, Nico. Thank you very much for having me here. It's such an honor. And I would like to thank Mental Health PH for this endeavor.
Ayan. Napaka-relevant po and timely ng ating topic for today. So today we'll be focusing on isolation, depression, and self-harm. So hatiin po natin siya into 3 segments. So let's start with isolation. Doc, ano po ba yung ibig sabihin natin when we say isolation? Paano ba natin siya ma-describe?
Okay. So during the current COVID situation, isolation can mean several things, no? Mm-hmm. So physical isolation means kailangan mo ihiwala yung sarili mo para hindi ka mahawa or hindi ka maka-infect ng ibang tao kung meron kang COVID. Pero this kind of physical isolation poses a lot of problems for us right now. Kasi human beings have this fundamental need to have social contact, no? Mm-hmm. So kahit hindi mo napansin before, yung mga small connections that you have with people outside, yung mga nakakausap mo sa mga stores, yung mga chika-chika ninyo over lunch, no? Yung mga hugs na kukuha ninyo sa mga loved ones ninyo. All of these things contribute to our everyday well-being. So alone, feeling separated, people can describe it na parang they feel empty, they feel invisible, insignificant, no? Walang halaga, no? And when you feel lonely, you start to it starts to make you think negatively na parang siguro lonely ako kasi I'm unlovable or inabandon ako ng ibang tao, when in fact you are lonely right now because kailangan mong protektahan ang sarili mo from COVID, no? So loneliness is not bad per se. Kumbaga, it's just a signal telling you na kailangan mo lang mag-reconnect, no? Mm-hmm. However, given the COVID situation, kung magiging chronic man ito, yung pag-social distancing natin at hindi natin alam kung hanggang kailan matatapos, the loneliness can develop into a type of depression or nagiging trigger siya sa depression.
Oh, so yun i-highlight na natin, Doc, na this is kind of a timeline or parang may progress siya, no? Na parang starting from isolation, it could lead to depression. Right. And yung i-highlight din natin later, it could lead to self-harm or something that is really serious na.
Correct.
And so, Doc, ngayon, paano naman po, kasi marami sa atin na nahiwalay sa ating families, especially for the students who come from different parts of the country. Marami kasi na parang sinabi nila magkakaroon pa ng online classes, and since merong mga students na walang internet connection sa kanilang mga provinces, they chose to stay in the metro. and marami sa kanila naiwan at nahiwalay nga sa kanilang pamilya. So how can we help a friend who is isolated from their family during this lockdown?
So, napakahirap talaga nung panahon ngayon kasi talagang we are not mobile, no? Hindi natin mapupuntahan yung mga mahal natin sa buhay. So, yung role tuloy ng internet at ng technology ay sobrang mahalaga talaga ngayon. So, if you have that is such a huge help to you, no? So, ang role mo ngayon is to be like a family member and be constant in connecting with that person online or virtually, no? Pero we don't want to be pushy naman doon sa taong yon. You ask that friend kung kailan o kung paano niya gusto na mag-reach out ka sa kanya. Pwedeng video chat, pwedeng through text messaging kung yun yung gusto niya, no? Some experts say that ideally sana may 1 to 3 virtual social connections kayo per day para ma-maintain mo yung feeling na parang you are not alone, no? You can also try to encourage them to join group chats, no? Yung group chat maganda kasi doon mo na-share yung mga pinagdadaanan ninyo, yung mga frustrations ninyo, no? Mga little things like yung mag-share kayo ng mga recipe ninyo, no? 'Di ba? Yung mag-share ng mga funny na online content, malaking bagay yung ganun. Basta yung maparamdam mo lang dun sa tao na hindi siya nag-iisa, no? Ang kagandahan rin sa technology, ang dami natin pwedeng gawin. Like, manood ka ng Netflix movie na magkasama kayong dalawa, habang nag-chat kayong dalawa sa phone, kumakain kayong popcorn, no? Yung magdi-dinner kayo together through Zoom, no? Mag-exercise together through online yoga. So, ang daming opportunity sa internet na pwede nating magamit. No? Another thing, pwede ka rin magpadala kasi through delivery. Kung yung care packages, kumbaga, no? Yung food, medicine or anything that your friend needs, pwede mo ipadala.
Yes, ayan. Aside from establishing an open communication, so yun nga, pwede rin na parang we can show our care to that person by giving them yung needs nila, like physiological needs nila. Okay, so now, Doc, kasi for those people naman who are with their families right now, hindi kasi natin maiwasan na may mga family members tayo na hindi naman ganun ka talagang ka-close dun sa family nila. Some would even label themselves as parang off yung vibes nila sa family nila. They have like an avoidant type of approach to their family, or they are emotionally distant. Now, what can we do to cope with these avoidant and emotionally distant members of the family during this ECQ?
Okay. So being at home all the time is actually very stressful para sa buong pamilya. Hindi tayo kasi sanay na magkakasama tayong lahat for such a long time in a very confined space. Dati nung nakahay, yung focus mo is spending time with your kids or your family members and doing household chores. Pero ngayon, ang nangyayari is wala nang boundaries na gano'n, no? So, you're juggling everything all at once, no? It's very, very stressful. Kaya ang nangyayari is talagang yung tempers ng mga tao pwedeng tumaas, no? Yung mga tao na hindi nagkakaugnayan, walang choice kundi magbamayan, no? Oh, correct. There are some other people naman na they would choose to be emotionally distant kasi ayaw na nila ng major confrontation, no? Or ayaw na nila na maging pabigat kung may nararamdaman sila na stress. And sometimes there are other people rin who may seem emotionally distant kasi yung kunwari mga introverts no, biologically madali silang ma-overstimulate from too much things happening in their environment. So that is their way of maintaining their energy and sanity. No? So I think the first thing that you need to do is understand that that other person needs a lot of space. No? And this space that you give is something that you should not resent. This is something that you should not overthink na parang, hindi siya nagsasalita. Ibig sabihin ba nun, wala siyang pakialam sa akin, ini-ignore ba niya ako, no? Because most often than not, ginagawa lang nila yan for self-preservation talaga. No? So, allow them a certain amount of time to just be on their own, habang ikaw pwede mo na sigurong kargado yung mga gawain sa bahay, pag-aalaga sa mga bata, no, and respecting that space. And ikaw rin, gusto mo rin may ganun ka din, no? Yun din yung maibibigay niya sa'yo, no? Just as important na meron kang space, personal space, you also need to find time during the day to be able to connect, no? Kailangan nyo talagang makipag-usap, no, ng maayos. You might need to initiate the conversation kung hindi komportable yung tao na yon, yung emotionally distant na person, no? Pero if you can, try to do it in a very non-judgmental, non-threatening way para mas madali para sa kanilang medyo mag-open up ng konti, no? So try not to hurl resentments at each other, no? Parang ikaw, ako na lagi nagbabantay yung bata, ikaw ganito, nakita ka, no?
Very common.
As much as possible, we don't do that, no? Try to understand how each other feels and try to work out together kung paano nyo matutulungan ng isa't isa. No? Talagang communication is very important talaga. No? Kung meron man mga konting hirit, no, na yung hindi natin nagugustuhan, have the grace to kind of let it go. No? Kasi most often than not, it's not an intentional thing na para saktan ka, kundi yun lang yung paraan minsan na nalilet out nila yung stress, no? If there are certain emotional needs that you want your partner or your family member to provide, you have to be very explicit about it, no? You have to say kung pagod na ako, ikaw naman yung gumawa nito, no? Or gusto ko lang muna magkulong sa kwarto at matulog muna habang ginagawa mo. So be very explicit para alam nila kung paano ka tutulungan, and be ready to give that help as well to that other person.
Now, Doc, I have a question po. Paano natin ma-differentiate yung pagiging parang emotionally distant, like yung pagiging introvert ng isang tao, compared to paano kung yung tao na mismo nakakaranas na pala siya ng loneliness niya na sinasabi natin kanina. Na kasi maaaring iba yung pagkakakilala ko dito sa taong to, and ngayon, nagbago siya. So, paano natin siya ma-distinguish? Kasi baka mamaya, that person, yung parang pagiging emotionally distant ng tao, it was already a call for help. Pero paano natin siya mai-differentiate?
Correct. Well, if that person is naturally introverted, you would know na, okay, ganyan talaga siya. No? Kung tahimik talaga yan, you won't be so alarmed na parang sanay ka na kasi na ganyan na yung ugali niya. Pero if you start to feel that there is something different, kung dating yung kinakausap ka naman kahit papano, the usual jolly person, bigla may sudden change, no, in the mood, which is persistent every day. Halos hindi mo na makausap, no? And I think what's important is you really have to ask, no, na, uy, okay ka lang ba? How are you? Napansin ko na parang nag-iba yung mood mo, or parang hindi ka na masyado nagsasalita ngayon. Is there something going on inside your mind? Baka sakali matulungan kita. So you have to really reach out and explicitly say na parang ito yung mga napapansin mo. And hopefully kung meron nga siyang pinagdadaanan, ay masabi nga na talaga sa'yo. No?
So parang it's a way for us to open the communication. So the importance of the word kumusta in the Filipino culture.
Talaga. Okay. Oo.
Ayan. Sige. Now, Doc, ito naman po, this is from a crowdsourced question. Paano po kasi yung person po natin, yung dad niya is an OFW, and hindi naman po siya kasi makauwi dito sa Pilipinas kasi syempre naka-lockdown tayo. So, paano daw po nila mako-comfort yung dad nila na nakahiwalay, and paano naman po na sila na isolated from that loved one? So, paano po yung gagawin nila for that?
Okay. So, alam mo, naawa ako dun sa mga OFW, no? Talagang malayo ka na, mag-isa ka pa, isolated ka pa, no? Doon sa kinatitirahan mo, no? So, they experience a lot of stress, homesickness, no? Worry about yung safety ng pamilya na kamusta kaya sila, mai-infect ba sila, sana hindi. May mapapadala pa ba akong pera? Magiging okay pa kaya yung trabaho ko, no? So, all of these things really add on to a lot of stress for our OFWs, no? And Again, the biggest comfort talaga is for the family to show their presence and constantly be there through virtual communication. Yun talaga yung sobrang importante sa lahat. I think the biggest comfort for an OFW parent is to know that everything is okay at home. No? So, constantly reassure them that, right, Dad, Mom, ginagawa namin lahat para masundan namin yung mga precautions. We're making sure that we are healthy, nakakakain kami ng maayos, no? Para maibsan yung worries nila, no? Try to communicate to them that there is nothing to be worried about, no? Kung ano man mangyari, nandiyan ang suporta ng pamilya para sa kanila, no? In this situation, yung parent, you try to encourage na kung meron silang saloobin na gusto nilang i-share o gusto nilang ilabas sa inyo, that you will always be there to listen to them, no? And ang kagandahan rin sa technology, they can also continue their parenting through virtual communication, no? So as a parent, you can be present during dinner, no? Dinner time. Again, yung manonood kayo na Netflix together as a family. Yung homeschooling, pwede kang magturo ng anak mo, no? Turuan mo sila ng bagong hobby. Pwedeng ikaw yung mag-storytelling time dun sa mga maliliit na bata. So you can continue doing your parenting even if it's a long distance, no? Also try to remind your OFW family members to do a lot of self-care. So kung offline sila, no, make sure that they're getting a lot of rest, they're eating well, they're exercising in their confined space, making sure they're taking care of their bodies, no, trying to find diversions, no, para maalis yung utak nila doon sa mga inaalala nila, yung mga bagay na sa ngayon hindi mo pa makokontrol, no. So try to pursue self-care activities.
Oh, okay. So parang, Doc, I just like to highlight the idea na hindi lamang basta open communication yung pwede natin gawin for the people who are away from us, but then trying to reassure them din na kung ano yung mga nangyayari sa atin and okay naman kami dito. Kasi it would really help with their isolation din.
Right,
okay?
Right.
Now, Doc, ito po, from the side of those people who would like to help, paano po natin malalaman yung limits natin? Especially kasi baka mamaya nag-overexert na po tayo sa pagtulong natin, or baka ang dating naman ay nakakatakot na baka abusuhin naman yung pagtulong ko. So ano po yung dapat natin gawin doon?
Okay. If we are talking about the context of providing emotional help, no? Lahat kasi tayo naniniwala tayo na in order to be a good friend, you have to be a good listener, no? You have to be a shoulder to cry on, no? For someone who's going through pinatapon na lahat sa'yo, lahat ng pain, lahat ng unhappiness nila, no? To the point na hindi na nila nare-recognize yung limitations nila. Like for example, odd hours of the day, tumatawag sa'yo, 1-2 oras, no, kinakausap ka sa telepono, paulit-ulit yung mga sinasabi, no, taking so much of your time, no, without showing any interest kung ikaw kamusta ka, no. So parang ang dating may pagka-selfish, no. You become what is known as a kind of emotional toilet, no? Ikaw yung tambakan na lahat ng sama ng loob. So eventually, you start to dread these kinds of conversations, no? Kasi parang napaka one-sided, nakakapagod, no? Napaka unsatisfying on your end. Okay? Pero for some reason, hindi ka makapigil kasi you feel guilty na parang pag hindi ako nakinig, hindi ako mabuting kaibigan sa kanya. No? Now, the question is, what does it mean to be supportive? Kasi kung patuloy-tuloy lang itong pag-dump niya ng mga problema niya sa'yo, no? Na ikaw, lagi ka lang nakikinig, saying words of sympathy, pero you notice that no personal growth is happening. That person is not doing anything to make their situation better. Parang nafe-feel mo may lack of insight na paulit-ulit niyang ginagawa yung mga mistakes, no? Very predictable na yung pattern. Kahit na ina-advise mo, ganun pa rin yung ginagawa niya. No? So, very toxic yung mga ganitong klaseng relationships, no?
Mhm.
So, in order to be a good friend, you have to encourage kasi that person you have to lead that person to personal growth, no? You have to
Yes.
be honest, no? And be frank na, alam mo, mali kasi talaga ang ginagawa mo. Ito talaga yung dapat mong gawin. No?
Mhm.
Be very direct about it. And do not tolerate the bad behavior to always repeat and repeat itself. Okay?
Mhm.
Ikaw, pag umabot rin sa point na ikaw sobrang emotionally stressed ka na rin on your own at hindi
Yeah.
mo na kaya yung burden ng ibang tao, then you just have to stop. No? You have
Yes.
to stop and focus on taking care of yourself. And you just have to be honest na, I've tried my best to help you, but I can only do so much.
Yes.
So, is it okay if we ask help from someone else, no? Preferably a professional na pwede makatulong sa'yo instead.
Mhm.
No? So, that's something that you can actually tell your friend. Minsan, merong mga kaibigan na nasasaktan, no?
Yes po.
Sa mga sasabihin mo pag nagiging honest ka. Pwedeng iwanan nila yung friendship, no? Ayaw na nila makipag-usap sa'yo and it may hurt a little bit, no? But don't take this personally kasi ultimately, it's their decision kung gusto nila magbago or maghahanap lang sila ng ibang tao na pagbubuhusan nila ng sama ng loob nila ulit. So, might as well use your time and all your effort to focus on meaningful relationships na nafe-feel mo na two-sided, no? Pati ikaw inaalagaan at sila rin may concern sa'yo.
So parang more on if ever na we're going to present this to that person in the most diplomatic way possible, you always have to remember din na we always have to focus na hindi po pwede na bigay lamang tayo ng bigay. Kailangan ay meron muna tayong ibibigay bago natin to ibigay.
Correct. Hindi
Kasi
tayo
totoo, ang weird din naman yun. Okay, now Doc, sige, let's move to another part. So from isolation, sabi nga natin kanina, it could lead to loneliness. And now we go into a more serious matter, which is depression. Now, Doc, ano po ba yung depression? And ano po yung pinagkaiba niya sa tinatawag nating sadness or yung loneliness niya?
Okay. So sadness it's a normal emotion, no? That is usually triggered by something difficult or hurtful, something challenging or disappointing that happens to us, no? So we always feel sad about something. So laging may dahilan kung bakit tayo nalulungkot. However, happiness usually ends, no? Pag nakaramdam na tayo na nakaka-adjust na tayo or yung nakahanap na tayo ng solution doon sa problema, kung time has already passed and healed, the emotional wound inside of you. No? Sadness is usually something that is transient. No? Yes. So right now, we feel sad about the COVID situation, but many of us find ways to cope and continue on with our new way of life.
Yeah.
Depression naman, on the other hand, yun definitely it's a mental illness, no? It's an abnormal emotional state that affects everything in our lives. Apektado yung pag-iisip natin, yung emotions natin, yung pananaw natin sa mga bagay-bagay, at saka yung behavior natin, no? It's very deeply profound. It's all-encompassing, no? Hindi lang siya simpleng nalulungkot ka lang palagi. You can feel a lot of things like emptiness, nagiging irritable, no? You feel exhausted or tired. You start to feel different things in your body. For example, yung energy levels mo laging bagsak. Hindi ka makatulog na maayos sa gabi. Hindi ka makakain, no? Or it can be the opposite. Sobra naman sa tulog, sobra sa kain. Nafe-feel mo na parang palaging negatibo yung pananaw mo sa mga bagay-bagay kahit na walang basis, no? Nawawalan ka ng motivation, nawawalan ka ng concentration na gawin yung mga kailangan mong gawin na mga bagay, no? When it becomes so severe, umaabot sa punto na you start to feel intense guilt or intense feelings of hopelessness. And ang worry kasi natin dito is if it gets really bad, it can develop into suicidal thoughts, no? Or yung magsusuicidal attempt, no? So, yung depression, hindi lang ito psychological na sakit, ito ay biological na sakit. So, physically, nagkakaroon ng mga chemical imbalances, nagkakaroon ng hormonal changes, no? So, that's why it's very important na ma-address ito through treatment or therapy, no, with a professional.
Ayun. No, Doc, question din, kasi it has been a common theme in social media na parang they post na parang I am depressed or parang I am sad. Kasi they usually interchange these two words. Now, kailan po natin masasabi or parang masasabi na okay lang na mag-post tayo about depression itself? And ano po yung parang maaaring repercussions? Kasi some people use it loosely na parang mailabas nila na parang I am depressed right now. So, what could we do as people who are receiving the information?
Okay. So when we see yung mga status update, no, ng mga kaibigan natin na nade-depress sila, pwedeng hindi lahat sa kanila depressed talaga.
Yes.
Pwedeng malungkot lang, tapos yung paraan ng pag-share nila is medyo in-exaggerate lang nila ng konti, no? Pero you know what? If you are in doubt, you have to err in the side of caution, no? It wouldn't hurt to maybe send a personal message to that person and kamustahin, no? Uy, okay ka lang ba? Nabasa ko dun sa status update mo na nade-depress ka. Pwede mo ba ikwento sa akin kung ano yung pinagdadaanan mo ngayon? Ano ba yung nararamdaman mo? Baka sakali share niya na lahat pala ng mga aspeto sa buhay niya ay may simptomas na ng depression, no? Hindi na gumagalaw, nakahiga na lang palagi, ayaw na makipag-usap, hindi na nagagawa yung mga pang-araw-araw na gawain niya, nag-iisip na pala na parang ayaw na niya, no? Ayaw na niya mabuhay. Then that's when we realize na, ay, oo nga, depressed nga pala talaga siya, no? So yun, so again, depressed nga talaga siya or hindi, it's so much better to double check kung depressed nga talaga siya.
Ayun. So parang the point really is for us not to discredit whatever that person is posting. Kasi we have to be on the side of caution. Kasi hindi talaga, we don't have any parang way for us to assess kung talaga bang depressed yung isang tao. I mean, we don't have the clinical knowledge for that. And siguro dun nga din natin ma-open na parang it would be best for them to seek for professional help if ever na it will get out of hand na. Ayun. Now, Doc, ito po, kasi it is a general theme also in the family that kids or parang the young generation, hindi sila, parang mas magaan daw ang buhay ng mga bata kumpara sa pinagdadaanan ng mga matatanda. Now, the question is how do these people or how do these kids or the younger generation open up about these feelings of depression or loneliness to their parents? Kasi syempre meron tayong fear na baka i-discredit lang or hindi mo alam kung paano yung magiging reaction ng mga kapamilya mo kapag sinabi mo na may problema po ako or ganito po yung nararanasan mo.
Okay. So, ngayong pandemic, no, hindi lang yung buhay ng mga adults yung nagbabago ng matindi. Malaki ang impact nito sa buhay ng mga bata. And our children also suffer a lot of major losses in their lives, no? You have to understand that they are also very social beings as well, no? Namimiss nila yung mga kaibigan nila, namimiss nila yung namimiss nila yung nakakalabas, nakakalaro sa playground, stretching out their limbs, no? They also have a lot of stress at home. Kasi yung bahay kasi na-associate nila sa, leisure time with your parents, no? Na pwede ka makipaglaro sa parents. Ngayon, yung mga magulang kasi kailangan magtrabaho, no? Kailangan magtrabaho sa bahay. So, minsan nasusungitan pa, no? Kapag niyayaya ng mga anak na maglaro sila, no? So, this is a very stressful situation for them. And sila rin, they are also prone to developing depression because of the major changes that happen in the currently, no? So, ang mga bata minsan nahihirapan na maging open sa mga magulang kasi they worry that they would not be taken seriously by the family, by the parents. Kasi like what you mentioned before, 'di ba? Ang mga magulang iniisip, ano pa ba ang hihingiin mo? Komportable ka dito sa bahay, no?
Yes.
Makakain ka naman na maayos, wala kang ang school ngayon, no? Pero again, like I mentioned before, they also suffer a lot of losses in their lives as well,
yes.
no? So, malaki ang role ng magulang, no, in trying to detect if their kids are experiencing depression. So, if your kid approaches you and says na parang hindi sila masaya or nalulungkot sila sa sitwasyon, you have to be able to talk to them in such a way na hindi nyo sila gina-judge, hindi nyo sila minamak, no, or yung parang niloloko or nire-resent yung mga sinasabi nila, no? And instead, you have to be very non-judgmental. You have to listen carefully to them, no? You have to really communicate in such a way na magtutulungan kayong dalawa kung paano nyo magagawa ng paraan, no? So you also have to be very observant with your children's behavior. Minsan, hindi sila talaga magsasabi kasi hindi nila alam na depressed sila. Pero if you notice na parang hindi na siya masyadong palasalita, hindi masyadong magpalaro, no? Yung energy level bagsak, no? Ayaw kumain, hindi natutulog ng maayos, yung itsura niya mukhang malungkot, pero you know what? Yung pinaka-common na mood ng mga bata when they're depressed is very irritable sila, no? Yung lagi umiiyak, laging galit, no? If they start to hurt themselves as well, headbanging, no, punching themselves, punching, hard objects. So when you notice all of these things, you have to really look for ways to address them, and you have to seek professional help, no. And luckily, right now we have telepsychiatry, so that you can access help from a child adolescent psychiatrist, no. So, on your own as a parent, no, aside from having open communication, one-on-one time with a child, try to structure yung everyday schedule nila para mabalance mo yung work time mo with play time with them. They need to feel that you are spending quality stress to something that is, something that would make them enjoy or would make them happy. Don't pressure them so much kasi ngayon, yung dahil may homeschooling, no, na nagpapadala yung mga teacher na mga worksheet, don't pressure them so much anymore na dapat masagot mo to lahat, dapat magawa mo to assignment mo. Kasi ngayon they're emotionally adjusting to the COVID situation, no? Yeah. So, hintayin muna natin na ma-stabilize na muna nila yung pakiramdam nila bago natin dagdagan yung stress or yung pressure sa kanila. And be aware of how you react, no? Be aware of yung temper mo, no? Yung wag yung biglang sasabog na lang. As much as possible, make your interactions together kalmado ka or cool-headed ka, no? So, yon. And also, try to arrange virtual play dates with the friends, no? Para naman yung mga namimiss nila ay nakakausap nila at nakakalaro nila.
So yun, parang i-highlight din natin na parang social beings pa rin naman sila. Hindi yun basta-basta lang na kayong mga may access lang sa internet, kayo lang yung makipag-usap sa friends niyo. They also have friends. And hindi lang kayong mga parents nila or those people within the family, sila lang yung maaaring maka-interact ng bata. Now, Doc, what can I do to cope with depression and suicidal thoughts on my own? Kung ako naman po mismo, yung wala po akong access na makausap na may makausap ako or hindi ako comfortable na makipag-usap sa mga kakilala ko. So, ano pwede kong gawin kapag ano?
If you are suffering from depression, lalo na kung may suicidal thoughts, no? And you are alone, you are forced to be alone, no?
Yes.
Napakahirap talaga kasi una, walang nakaka-monitor or nakaka-observe kung nag-worsen yung condition mo. Or wala yung physically na tutulong talaga sa'yo. So, in a way, you are solely responsible for taking care of yourself. No?
Yes.
First of all, kung mahirap para sa'yo makipag-usap sa ibang tao, you have to understand na napaka-importante kasi na meron kang kausap, no?
Yes po.
Kasi kailangan mo ng suporta, kailangan mo ng hingahan, kailangan mo ng i-unload yung problema mo, kailangan mo ng tulong na i-figure out kung paano pagdaanan yung problema mo, no? I know that a lot of depressed people have tried to reach out to family, no? Or nafe-feel nila na parang hindi nila na nakukuha yung gusto nilang tulong dun sa mga tao, no? So, kung wala kay ibang choice, please try to reach out to our psychiatrists online para sure tayo na yung kailangan natin na tulong o yung gusto nating marinig na salita ay makukuha natin dito sa mga professionals na to, no? A lot of people also tend to not say anything kasi ayaw nila ma-burden yung family, no? Pero you know what? Your family loves you enough to carry that burden with you in a very loving way, no? So don't underestimate yung kakayahan ng pamilya mo na tulungan ka, no? Kasi if you were in their position, kung meron ka namang kapamilya na nade-depress, hindi pa ikaw din gusto mo rin silang tulungan.
Yes,
no? So you have to give them a chance to be able to support you, no? And ease some of your burden. Okay? So aside from talking to someone, no, kahit ayaw mo, no, you really need to talk to someone. You on your own, you have to look for different ways to take care of yourself. Like I mentioned kanina, no? Try to create a lot of self-care activities, no? Try to no foot massage, a warm bath, reading and mafe-feel mo pa rin na meaningful pa rin yung ginagawa mo every day, no? Kasi sometimes people tend to feel depressed kung na feel nila na walang purpose yung buhay nila, no? And every day kasi na nagpapatuloy tong social distancing, nafe-feel mo talaga na parang nawawala ng purpose yung buhay ko, no? Try to meditate or find some sort of breathing or muscle relaxation techniques. We have that in our website sa Medical City, no, on YouTube. So that's something that you can use now.
Ayan, thank you, Doc. Now, before tayo mag-continue sa ating talakayan, I would just like to remind everyone that if you have any questions, our comment section is available. Nandun lamang sa ating ilalim ng screen. You can type your questions there and our community moderators will get them and itatanong din natin ito sa ating guest speaker. Now, kung nasa Twitter naman kayo, you can also use #MHTalks and our community moderators will get those questions for you. Now, balik tayo sa ating talakayan. Now, we focus on a very serious matter, which is self-harm. Now, Doc, ano po ba yung self-harm and ano yung maaaring maging triggers natin for self-harm itself?
Okay. So self-harm is the act of deliberately hurting yourself by inflicting pain or causing injury, no? So some common ways of self-harming would be, cutting your skin with a sharp object, hitting different parts of your body, punching, head banging. Itong behavior na to, usually hindi naman intention ng isang tao na magpakamatay, no? But usually this is intended to be able to relieve the build-up of a lot of pressure, yung intense and distressing thoughts and feelings na nararamdaman ng isang tao. For example, nakakaramdam siya ng intense na anger, guilt, sadness, shame, no? Self-harming is a quick way to be able to feel calm or to relieve tension when there is emotional overload, no? Yun nga lang yung problem sa self-harming. Pagkatapos mo ma-feel yung temporary relief, saka naman dadating yung feelings of guilt and feelings of shame, no? Na parang bakit ko na naman nagawa yun sa sarili ko, no? Napakawalang kwenta ko talagang tao, no? And yung mga thoughts na yon and feelings would then siya na naman yung mag-i-initiate ng mga future episodes of self-harming. So as you can see, it's a very vicious cycle.
Yes.
Vicious cycle siya. So self-harming is usually indicative of mental health issues. Yung mga taong may ganito usually may trauma, no? Lalo na childhood trauma. Pwedeng may depression sila, anxiety disorder, or meron silang personality traits na hindi maigi yung pag-adjust nila sa adversity, no? So anything stressful can trigger this. The COVID situation can trigger self-harm, any kind of work, school stress, bullying, feelings of low self-esteem, no? Relationship problems, financial problems, having an illness, all of those things can trigger self-harm.
Ayan, Doc. Now, yun, as na-mention nyo na nga rin po kanina na parang COVID-19 itself can be a trigger for self-harm. Now, Doc, paano po naging trigger yung COVID-19 itself? Kasi we would like to understand how this pandemic itself could make us, parang maaring maka-apekto rin yun sa atin talaga.
Okay. So yung COVID-19 situation can be a trigger for suicide because again, it's so stressful, no? It really creates a lot of stress in all aspects of our lives. So nakaka-depress siya kasi you lose control of a lot of things in your life, yung mobility mo, yung capacity mo to work. You lose your freedom to be able to go out and pursue the things that interest you or that make you enjoy, no? Usually, yung pag umaabot kasi sa punto na matindi yung stress, no, at hindi talaga na natin kinakaya, your mood becomes so severe that you start to think very negatively, no? Na parang pagkatapos ng COVID na to, siguro mawawala na ako ng trabaho, hindi ko na mabubuhay yung pamilya ko, no? Na parang you feel hopeless about your situation, no? So when that hopelessness sets in, that's when the suicidal thoughts happen, no? Na parang dahil hindi ko na kaya, gusto ko na pakamatay kasi it's the easiest way out na of this situation, no? So talagang very strong trigger talaga for suicide yung COVID.
Yung COVID-19, yes. Parang it's a very multifactorial problem. And one way for us to parang attack this situation is very multifactorial din. Hindi naman siya basta-basta lamang natin na titingnan na ito lang yung pwede natin gawin. Marami tayong maaring maging tulong para sa mga tao na maaring nagsi-self-harm because of the COVID-19 pandemic. Now, Doc, is there an association of posting sad memes in social media? Kasi it's very common right now na marami sa atin sa mga younger generation, nagpo-post sila ng mga infographics or parang mga comics na may mga subliminal meanings and pumapasok na yung idea of self-harm. Now, meron po bang connection to sa suicidal ideations? And is it okay for us to post things like this?
Okay. So, most likely not everyone who posts the sad memes are depressed or suicidal. No? Pero what we have to be aware of is baka merong maliit na porsyento sa mga nagpo-post na yun who are actually depressed and suicidal. No? Kasi this could be their indirect way of trying to seek help from us. No? It's a cry for help. Without being very direct about it, no? Kasi ika nga, ang depressed na tao, ayaw nga nilang mag-burden ng ibang tao. No? So they won't explicitly say. No? So kung 1 out of 100 man na mga tao na nagpo-post ng sad memes ay depressed at suicidal, kailangan natin ma-detect yung isang tao na yon. No?
Yes.
So as a friend, you send a personal message. So you don't have to be very public about it. Sendan mo ng personal message. Uy, nakita ko tong sad meme na to. Ano ibig sabihin nito? May pinagdadaanan ka ba? No? Konektado ba ito sa buhay mo at pinagdadaanan mo ngayon? No? So, hopefully that would be an avenue for that person to open up and directly say na oo, meron nga akong pinagdadaanan. Kailangan ko ng tulong. No? So, it's very important that you check up on that person kung nakikita niyo itong mga sad memes na to.
Ayan. So, parang it's also a reminder for us not to discredit these things na maaring hindi siya explicit na sinasabi na I am sad or I am depressed. Kasi it's a common theme for us Filipinos na parang we insert humor in a lot of the
Correct.
things that we do.
Yes.
So maaring parang pasaring lamang siya pero hindi natin siya po pwedeng pabayaan na lamang. If we think that these things are kind of connected to self-harm or suicidal ideations, well, dun papasok yung isang napakalakas na salita which is kumusta, 'di ba? So we get to connect with those people and try to open a channel for communication with them. Ayan. Now, Doc, we have a lot of questions from social media right now. Our Facebook Live is really booming. And ito po, we have questions. This one is from April Dadol from Facebook. Paano po ba makontrol ang inner sadness? Kasi ayaw naman daw po niya maging irritable, pero di daw talaga niya makontrol yung sarili niya. Ano po yung po pwede niyang gawin regarding this?
Okay. So, if you feel very angry, no? Yung parang gusto mong magwala, gusto mong sumigaw, gusto mong magalit, no? Itong anger kasi, this is a natural emotion to have if you're going through something difficult. Hindi mo talaga mabablock or mapipigilan yung nararamdaman mo. Pero you know what really matters in the long run is the behavior that you put out there given the emotion that you have. Your response to what you are feeling is what really matters, no? So, if you are feeling very angry, I hope you are able to find a way to be able to hold that anger, no? And try to think about the best response that you can give at that very moment, no? Kung hindi kinakaya, try to go to a certain space. Lumayo ka muna dun sa taong kausap mo, no? Bigyan mo muna yung sarili mo ng oras o panahon para kumalma. Tapos pag medyo okay ka na, then balikan mo yung tao at pag-usapan ninyo ng maayos or ng kalmado yung problema na kailangan nyong ayusin, no? So yun. So try to remove yourself from that situation that will make you behave in such a way na hindi mo magugustuhan. Okay. So kung sanay ka na laging naninigaw, no? It will take a lot of practice talaga, no? To be able to respond in a calm manner. Pero you can try to look for ways para matulungan yung sarili mo in that way. Yung meditation, no? That's something that you can use para ma-exercise mo yung part of the brain that is able to control all of those strong emotions. No? So again, it helps you build up that ability na magkaroon ng emotional space na kaya mong hawakan yung anger, no, yung negative emotion na yon at mapag-isipan ng maigi kung ano yung pinakamainam na paraan na pwede kang mag-respond doon sa sitwasyon na pinagdadaanan mo.
Ayan. Now, Doc, ito po. This one's from Arian Abril from Facebook din. Hi po. How to prevent self-harm and what if self-harming itself makes you feel good? Kasi parang we highlighted a while ago na it is a vicious cycle and maaaring merong konting feeling of parang naging okay sila with self-harm. Pero ano po yung pwede nilang gawin para sa mga ganun?
Okay. You know, self-harm really feels good, no? Talagang ano yan napakabilis ng relief na nararamdaman mo pagkatapos mo siyang gawin. Kaya some people actually describe it as something that is very addicting, no?
Yes.
And man yung mga thoughts and feelings na wala kang kwenta, no? Na bakit ko na naman nagawa ito sa sarili ko, no? Na you feel very shameful about it, no? So it doesn't mean that it makes you feel good, that it is something that is actually good for you. No? So there are many ways that you can do to help with the self-harm process. But you have to realize that, you know, if self-harming is a habit for you, this is a long and hard journey that you have to go through. It's a process. Hindi yan yung overnight, pag narinig nyo na tong talk na to, hindi na kayo mag-self-harm.
Yes.
You know? So it's a process that a person has to go through. No? First of all, when you want to self-harm, try to talk to someone. No? So, I already emphasized the need previously na kailangan mo ng kausap para merong suporta or hingahan ng pinagdadaanan mo. And this person can also serve as a diversion, no, hanggang sa maging okay ka ulit. No? So, talking to someone, it's not a weakness. No? It is a way of taking charge of your well-being and taking care of yourself and being healthy. No? So try to look for a trusted person, a family member, a friend, your psychiatrist, no? A spiritual advisor that you can talk to. No? Number 2, try to distract yourself. Kasi these strong emotions come in waves. No?
Yes.
So, after a certain amount of time, nawawala din sila. So, distraction techniques are useful to divert your focus from doing something harmful hanggang sa mawala na yung urge to harm yourself passes. No? So, one way that you can do is the 5-minute rule. No? Na you tell yourself, okay, for the next 5 minutes, hindi ko sasaktan yung sarili ko. No? Itatime mo yung sarili mo. No? When that 5-minute passes, you tell yourself, tatry ko ulit after 5 minutes na wag saktan yung sarili ko. No? So, try to prolong those 5 minutes over and over hanggang sa mawala na yung feeling na parang gusto mo saktan yung sarili mo. Number 2, you can try to write down yung thoughts and feelings that are distressing you sa papel. And you can crumple it up, rip it apart and throw it away as if you are letting go of those negative thoughts.
Okay.
No? Okay. If you are feeling very agitated talaga, no? Very agitated, na parang gusto mong manakit, you can try to hit something soft like a pillow or a cushion, no? Pwede kang sumigaw doon sa pillow na ayun if you want, no? Pero as much as possible, don't try to hit something hard or something that can injure you. No?
Yes.
Again, with the distraction techniques, try to, watch your favorite movie on Netflix, no? Listen to your favorite music. Maglinis ka ng kwarto mo, no? Yung parang lang mabisi yung utak mo at lumipas yung oras. Again, try to utilize yung meditation and breathing techniques, muscle relaxation techniques that we have doon sa YouTube channel namin sa Medical City. Practice a lot of self-care. Ang maganda rin is yung makahanap ka na activity that will physically comfort and soothe you. Warm bath, no? Yung warm shower, foot massage, aromatherapy, no? All of these things can help soothe you when you are feeling very much distressed. Very important to try to remove your access from yung mga objects that can harm you, yung mga sharp objects, mga weapons. Tell your family, please pakitago itong mga blade, itong mga knives, scissors, and all of those things. So, para hindi ka matempt na gamitin sila. Ha? Pero ultimately, yung makakatulong talaga sa taong nagsi-self-harm is to seek therapy talaga. No? We have therapies like cognitive behavioral therapy, dialectical behavioral therapy, mindfulness therapy that you can try out with your psychiatrist. No? So again, please avail of telepsychiatry, no, para maumpisahan yung therapy that can address self-harm.
Yes. And so parang more of it is a conscious effort for you to try to convert something that is abstract, yung emotions na nararamdaman mo, into something that is concrete. Like katulad nung highlight niyo po kanina, Doc, na parang you can write it on a piece of paper. And though for some people, they would think that it is symbolical lang, na parang kasi yung iba, they try to downplay the idea of parang yun nga, parang nag-release ka ng problems mo through something that is written. But then it could really help then for you to be distracted and mailagay mo rin yung emotions mo into something more productive or parang at least a journal, something like that. Ayun. Now, Doc, highlighting what you said earlier na parang kapag nandun ka na sa idea na magsi-self-harm ka, you can communicate with someone, right? Now, this question comes from Jeril Glide Bagnol from Facebook also. So, paano naman daw po kapag, paano nila matutulungan ang isang tao kapag sila naman, yung tao yun, yung lumapit sa iyo na parang, I want to do self-harm. Kasi parang, okay, that person already acknowledged that I have to talk to someone. What if ako naman po yung kinausap ng tao na gusto mag-self-harm? What can I tell that person? And ano yung kailangan kong gawin?
Okay. So, it's very important that you will be a good listening ear to this person, no? You can start by asking, kamusta ka? No? How are you? No? You can even be later on direct Kung kunwari may nakikita ka ng mga scars, for example, sa arms, be direct about it. Napansin ko na may mga cuts ka sa arms, no?
Yes.
And I'm feeling very worried about you because I care a lot for you, no? Are you hurting yourself, no? So if you approach that person in a very compassionate, very respectful, very judgmental manner, no? This person will be able to open up to you, no? At mas lalo mo siyang matutulungan pag nag-open up siya sa'yo. Don't make them feel guilty about what they're doing, no? Na parang, hindi ka ba naawa sa magulang mo na ginagawa mo yan, no? Hindi ka ba naawa sa sarili mo, no? Don't give them ultimatums like, kung hindi mo tigilan yan, hindi na tayo friends or hindi na kita kakausapin, no? Yung mga salita kasi na ganito are counterintuitive, no? Mas lalo mong ginagatungan yung feelings nila na they are isolated, na they are misunderstood, that they are not important, that they are powerless, no? So mas lalong nai-encourage yung pag-self-harm ng tao na yon. So again, you have to understand as someone who is not experiencing this, no? This is a long and hard journey, no, for someone na nagse-self-harm, no? Hindi lang madali mag-quit sa self-harming out of sheer willpower, no? You need to go through therapy talaga para matutunan mo yung mga coping skills, no? You need to practice each and every day kung paano mo babaguhin yung behavior mo. And sometimes there will be days that are really bad and you will fail, and you will go back to your old ways, no? Pero as a friend, you need to be very supportive. You need to tell that person, it's okay if it happens. It doesn't mean that you're backsliding. It just means na marami ka pang kailangan pang matutunan, kailangan pang mag-practice pa, no, kung paano ma-strengthen yung coping mo, no. If they don't feel comfortable talking about it, no, ayaw nilang mag-open up. You have to respect that, no. But let them know na okay, pag ready ka na, nandito lang ako para makinig sa'yo, no. Pag ready ka na, siguro hanap tayo ng paraan kung paano ka tutulungan. And try to gently prod that person regularly, no?
Yes.
Even if it will take days, weeks, or months, no? Be very patient about it. Later on, may kita mo mag-open up din yung tao na yan sa'yo, no? And try to encourage help-seeking behavior. I-encourage nyo sila na magpatingin, no? Tell them na I'll try to help you as much as I can, but I can't do it alone.
Yes.
So is it okay if we try to get support from someone else who knows better about these things? No? So again, try to utilize telepsychiatry for your friends who are self-harming.
Yes, ayan. And one thing that we want to highlight, yung sinabi din natin kanina, huwag kayong magbibigay ng isang bagay na wala ka naman sa sarili mo. So learn when to pause. No, hindi
Right.
hindi po pwede na linapitan kanya pero ibibigay mo rin lahat-lahat na. So you always have to remember na yung mental health mo rin is kailangan mo rin siyang protektahan. Ayan, maraming salamat po, Dr. Santa Maria. This has been a very insightful discussion. Do you have any last words for our viewers?
Okay. Thank you very much as well, Naiko. Thank you to your team. Malaking tulong talaga itong ginagawa ng Mental Health PH para sa ating mga kababayan, no? Kasi napakahirap talaga nitong COVID-19 na sitwasyon na pinagdadaanan natin, no? What I want everyone to know is kung nahihirapan kayo sa pinagdadaanan ninyo, no? Kung feeling ninyo kailangan nyo ng suporta, please don't hesitate to reach out to us sa aming nasa psychiatry community, no. The mental health PH Facebook page has all the information that you need para makontak po ninyo yung mga professionals po natin. So there are links to hospitals like, you know, the Medical City, NCMH, no. All of us in our community will gladly help you out, no. Hindi kayo nag-iisa. Okay?
Ayan, maraming salamat po, Dr. Santa Maria. And meron po tayo, yung directory po natin, it's on your upper right corner, nandun po yung ating link. And sa ating baba, nandun po yung ating mga hotlines for the National Center for Mental Health and the Medical City Department of Psychiatry.
Right. Can I just reiterate, no? Sa Medical City, we have our outpatient department, yung Center for Behavioral Health. So we offer online consult, so telepsychiatry, so for anyone who needs our help. So please don't hesitate to contact us.
Ayan, maraming salamat po, Dr. Santa Maria. Sobrang dami po namin natutunan. And for those people who have other questions pa, huwag kayo mag-alala dahil we have our community moderators who are getting your questions and maaaring matulungan pa rin namin kayo. We also have our residents from the Department of Psychiatry who can also help you with those questions para masagot natin to. Ayan, bukod sa mga doktor at nurse, salamat din po sa ating mga bayaning medtech, radiotech, AIDS, utility at mga gwardya sa ating mga ospital. Binibigyan pugay din natin ang mga frontliners sa ating mga checkpoints, mga pulis at militar, mga community health volunteers at mga nagtatrabaho sa botika, grocery at palengke, lalong-lalo na rin sa ating mga local government units at barangay workers at mga basurero at iba pa. Ako po muli si Naiko Bautista ng Mental Health PH and maraming salamat sa pagsubaybay dito.